Andrea and Wyatt Artz had just 5 minutes of skin-to-skin contact with their daughter Catherine after she was born.
Delivery was fine, and she was initially doing fine, and then she crashed.
Her oxygen saturation levels were abnormally low.
She was born at Sanford Health Partner Hospital, Ortonville Area Health Services. Providers worked tirelessly, but knew she would need a higher level of care.
We actually had her in a snowstorm, so the Sioux Falls said, well, we can't get to you.
The anesthesiologist actually held up the oxygen mask to her all night.
The storm finally cleared, and she was flown to Sioux Falls. Upon arrival, Dr. William Waltz and his team ran an echocardiogram to get a better look at Catherine's heart.
Her right atrium is really not happy because of the high pressure it's under, because this right ventricle should be the same size as the left, and it's way underdeveloped and really stiff under high pressure. And this is not a happy heart.
She was on 100% oxygen and on like 30 different medications, and nothing was working.
Her providers decided to put her on an ECMO, or extracorporeal membrane oxygenation machine. An ECMO machine temporarily takes over the duties for a patient's heart, allowing the heart to heal and rest.
We put someone on ECMO when we're confident that if we don't, they're going to die.
Dr. Jody Huber is a pediatric intensivist and the medical director of the PICU at Sanford Children's Hospital in Sioux Falls.
The tubing for the ECMO circuit. This tube here has a large IV, we call it a cannula, and this is what takes blood outside of the patient. And then this cannula here is what returns oxygenated blood to the patient. If we follow it back, this is where it goes in, and this is our oxygenator. This is what removes the carbon dioxide and places oxygen into the blood. And right behind it, that's where the pump is that helps take the blood out of the body and return the blood to the body. And this is where the oxygenated blood comes out and goes back to our patient.
She said an ECMO treatment comes with risk, mainly due to the need to thin the blood.
And we always worry, especially in our neonates, could they develop a bleed in their head? That's the most worrisome thing that we have. So once you get on ECMO, we like to do our best to try to get them off of ECMO.
Catherine was on the ECMO machine for 13 days. Throughout everything, Wyatt and Andrea never lost their faith.
The priest had came and baptized her, and that was the first night. And then after she was off ECMO and not doing very good, a priest came again, and he distributed communion to us, and he laid the host on her and prayed over her. And then it wasn't immediately, but it was about that same day where her numbers just slowly started to rise again.
When mom and dad are praying for the baby, God listens.
Catherine is back home now with her family in Gan Valley, South Dakota, and playing with her two big sisters every single day. She comes back for regular checkups every 6 months, but she's otherwise happy and healthy.
As hard as it was to see her going through such a difficult time, I just heard the Holy Spirit say, like, it'll be okay. Like, she's gonna get through this, and she did.
In Gan Valley, Simon Floss, Sanford Health News.